tomorrow's meeting, I think, as the first annual meeting, is fantastic. I mean, we're 18 months into this work, so it's not like we've just started, but we're going to have this meeting, which I think is nice. And also, it's very patient focused tomorrow. We're listening to patients and families and trying to make certain that we're bringing their views into everything that we're doing here. At the end of the day, it's a success across the industry, and all of that work and those efforts are really focused to patients and families with rare disease. And so I like that our first annual meeting is focused to those constituents.
We are part of a larger program called the Accelerating Medicines Partnership Program. And again, this is one of our very large public-private partnership programs that was started back in 2014. This is an opportunity to bring together the resources of the NIH, the resources of the private sector, to move the field forward in pre-competitive ways to accomplish things that neither the NIH or the private sector could accomplish on their own.
I'm a big believer in in-person meetings, and the BGTC group has been for 3 years virtually, and we've all accomplished a tremendous amount. But there's nothing like sitting down and having a cup of coffee together and actually meeting people in person. I think that it's only going to accelerate and improve the progress that's happening.
Some of the key people that have been working on this are going to present a little bit on all the great work that FNIH has done on this program. And I'm privileged and honored to be moderating a panel discussion at the end with PJ Brooks, Deborah Miller, Peter Marks, and Sadiq Kasim from Danaher, who are all part of the consortium, just to really share that vision with the broader group.
When we first decided to sponsor this back 3 years ago, pre-pandemic, it was really a no-brainer. It's just the expertise that was in the same room, both private and public, was incredible.
It has been a tremendous pleasure to engage with the BGTC and to engage with the individual members on the manufacturing side, on the clinical side, to select the diseases that we are taking forward as these cases to try and make these improvements. I think that everyone on this broad project is highly focused to delivering therapies for all patients with rare disease, which means that the learnings that we take away from this, we're going to all be focused on pushing them out into the industry and trying to, make these therapeutic discoveries happen faster, safer, and become more accessible to patients around the globe.
This is the most exciting thing that I've had the opportunity to work on, and I think in part because it's so easy to see the direct benefit to actual patients in the community. Bringing together such a large group of consortium partners, being able to work with incredible subject matter experts in all the different spaces that the gene therapy field relies on to move things forward. There's just such a great enthusiasm from the partners, from the community, and being able to kind of oversee and shepherd all of that work is very meaningful to me.